Hello student, welcome to online nursing classes. Especially I have prepared this classes or a notes for GNM, BSc as well as a ANM nurses also can refer, and very easy way how much is required, only that much I have prepared the notes. So when I'm if you want to make a notes, you can pause the video and you can write down the notes, as well as when I'm explaining, I may add up some extra point, so you can write down the points. So today I'll be taking class on oncology nursing. So before I could move on class, let me introduce myself. My name is Nirmala Trindad. I have done my PBBSc nursing under Rajiv Gandhi University of Health Science, Karnataka, Bangalore. Apart from that, I have done my MA Psychology, Child Mental Health. I have got more than 9 years of teaching experience. So let me move on class now. So oncology. So what is the meaning of onco? Onco means tumor. Logy means study. So oncology means it is a study of tumor or abnormal cell growth. So oncology is a branch of medicine. Here we will be studying about abnormal cell growth. So it will grow in the body without fulfilling any purposes. So what is cancer? You might have come across a term and you have heard every often that that person is suffering with a cancer. So what is cancer? Cancer is a disease where cells in the body grow and multiply out of control and capable of invading. So what's the meaning of invading? Enter into another body organ or a vital organ. So when it enters the abnormal cell growth, simultaneously what it does, it will compress that normal tissue or a organ and it will destroy normal tissue. Simultaneously, the function of that particular organ will be altered. So that's the cancer. Is a very important for 1 marks they will ask. So you can see in a picture how the cancer cell will be. So finger-like projection you can see. Okay, what's the symbol of cancer? You have seen that wherever cancer, the symbol they will show crab. So why crab symbol? See, Greek Hippocrates and physician Celsus gave the name of cancer meaning crab. Hippocrates means scientist. Why they gave cancer meaning crab? Because you can see in the picture the crab is having projection, finger-like projection. In the same way, cancer cell also will have a projection. Through that finger-like projection, it will going on attack as well as attract a neighboring structure. One by one, it will attack, it will destroy. Cancer symbol is a crab, finger-like projection. Okay, now our human body develops from a single cell called as zygote. So this you will learn in a 3rd year under OBG. Okay. Fusion of ovum and spermatozoa, the zygote will form. Okay. Ovum from a female and spermatozoa from a male. So from there, the development of baby fetus will takes place. So multiplication of cell occurs throughout the lifespan of the individual. This is a normal mechanism. See, our body is made by millions of cells and each cell will multiply throughout the lifespan. So what is the normal mechanism of these cells? Let me see here. See, normal cell always undergo multiplication. The 2 will become 4, 4 will become 8, 8 will become 6, 16. So in that way, so once it reaches a particular particular matured size, specialization. See, every cell has meant to do particular work, or every cell in our body has some purpose. So it will fulfill its purpose. So after finishing its purpose, it has got a lifespan like death. Death will occur and regeneration, reformation of cells will takes place. Now you can see the red blood cell. The lifespan of red blood cell is a 120 days. 120 days, what it does? What's the function of red blood cell? Carrying oxygen. It does its work After the 120 days, it die and a new red blood cell will grow. In the same way, the skin cells, what is the lifespan of skin cell? 2 to 4 weeks. So what it does, what is the responsibility of skin cell? Protecting the skin from injury, infection and maintaining normal temperature. So after the 4 weeks, this normal cell will die and the new cell will regenerate. In the same way, the millions, whatever, how much cells are present in our body, every cell has got its own purpose, duty, work. So once it does, then death occur and reoccur new cell. This is the normal phenomena. But in case of cancer cell, what happens? The cancer cell will multiply. The 2 will become 4, 4 will become 8. The death will not be there. It will multiply, and it will hijack, occupy other organs' place. It will invade, it will destroy the normal cell of the body. So why this multiplication will occur? How come the cancer cell development will occur? Due to changes in genes, that is called as a gene mutation. So why the gene mutation will take place? There are various reasons are there, okay? Gene mutation means biochemical changes in genes and entire cells. So you can see in a picture here the normal gene, the normal anatomy of the gene, how it will be. But you can see that gene mutation, damage of the gene, means the biochemical changes in a genes. So you can see in a picture how the damage has taken place and all the chemical inside the cell, whatever present, it comes out. See, our body is, what is a gene? See, every cell is made up by DNA and RNA. DNA consists millions of genes, and every genes represent the body's each cell, what work, what purpose it has to do. But when this genes are destroyed, it is unable to fulfill the purpose of the cell. So that is called as this is a process of how the cancer cell will occur and what it does. So types of tumor. So there are mainly 2 types of tumor, is the benign and malignant. So what's the meaning of benign? Benign means it is also type of a tumor, but it is not dangerous. It will not spread to other body organ. So once doctor diagnose, through the surgery they will remove and over, the patient is completely fine. Sometimes, very rarely, it may reoccur. So the solution is through the surgery remove, but there is no any danger to client. So that is a benign tumor. Example, fibroma, lymphoma, leiomyoma. Oma means when it at the end it suffix it comes oma, means it is a cancer. So what is malignant? Malignant is a danger tumor. What it does? It is spread to each body, each vital organs of the body, and it is once it is a spread, it is not curable. Only in order to increase lifespan of the client, the doctor will treat only that much, and it is a very harmful to the person. So you can see in a picture. So this is an example for in the picture, fibroma, small like growth. It will not spread, or it will not spread to any body organ. Through the surgery can remove. So this is the cancer cell, how it is come out, and it will spread one organ to another organ and entire body. So what are the difference between benign and malignant cells? It's very important, okay? Sometimes they will ask for the 2 marks or a 5 marks. So malignant tumor differ from benign in 4 biological properties. The one is a structure. Structure means anatomy, how it will be. See, the benign tumor will be very soft, okay? If it is sometime it is a hard also, it has got the capsule, okay? It will not, that's only it will not spread. But malignant is a very firm, very hard, without capsule. There is no capsule only. Capsule means you know that external covering. So since there is no capsule, the cancer cell will come out from inside the cell and it will spread to other body organ. So rate of growth, the benign is very slowly growing, but the malignant will grow faster than benign. Invasive growth. Invasive growth means it will invade means it will hijack neighboring structure one by one and cause serious health issues. Now, for example, might be it is a cancer of the lungs. From the lungs, it will go to liver. So, as the liver, it will affect, liver will fail to do its function. From the liver to kidney, once kidney is affected, kidney will fail to do its function, and it leads to various health issues. The fourth one is a disseminated growth by metastasis, means it will destroy one by one organ and all the normal mechanism means function will be altered. So these are the main four difference between benign and malignant. They may ask for the 2 marks, okay student. What are the characteristics of benign and a malignant? So there are many points are there. So you can write down this. They will ask for the 5 marks, very important. You can pause the video and you can write down the points. Okay, now let me see what are the causes for cancer. Actually, exact causes for cancer is unknown. There are many predisposing factors or contributing factors are there. Let me see one by one. So the first one is a hereditary. Hereditary means family history. Like in your family, if anyone has got, there is more chance it will be continued for the future generation. Second one is the age. All the age are affected by the cancer. It is also, once upon a time it used to tell only for the aged people, and especially it's meant for only for the rich people. Now it's not like that. The newborn itself will be having a cancer. So all the age and all the gender also, male, female, it is not left to any gender also or any age also. It may come any age. Geographical distribution. The cancer is very high in the United States, not in others, Asia country like our India also, and it's there in more in India also. But comparing to India, it's a very high in the United States because of their lifestyle, because their eating pattern. So they are more from this junk food only, burger and other things and all. So they are very prone for the breast cancer, colon cancer, and their bowel habit is it's not like daily, once in a 2 days, once in a 3 days, because they eat this burger like that and like junk foods and a processed food. Occupations, especially the people those who are working in a chemical factory. Chemical factory, the chemicals which is released from the factory is very poisonous. They will inhale that same things, and it has a more, it will go and deposit in the lungs, respiratory system, and later there is more chance they may get a respiratory cancer of the lungs, larynx, pharynx, of any of the organ. So gender is a common in a male cause of their habit. It is a like a past slogan, but it is a common in a both the gender also, because due to habit it's common in a male also, female also. Now drinking, the males are also drink alcohol, females also eating gudka, drugs, both the gender also equal. So it's a gender is a equal, we can say now. So physical agents like prolonged exposure to sun. See, sun exposure is a very much needed. So when morning 6 o'clock to 10 o'clock. So vitamin D. So to get a vitamin D. So after that, you know that our ozone layer is destroyed. From the ozone layer, the UV radiation is releasing. So we are not supposed to expose after 10 o'clock to 3:30, 4 o'clock. So after 4 to 6 is a good, and morning 6 to 10 or 10 a.m. is a very good. UV rays, X-ray. So not supposed to expose to X-ray many time, and especially the medical professionals. When as a nurse, when you are taking patient to X-ray department, or if it's a the if you want to stay in a X-ray room, you have to use that protective devices. If the X-ray technician they are not giving you, it is your responsibility. You have to ask with them. Even CT scan as well as a tanning bed. So what is tanning bed? Tanning bed is a indoor tanning, especially this sedentary life leading people, and especially those who are not exposing to sun. They will go to spa, gym, or a hotels and hi-fi hotels, and artificially they will expose to this tanning bed. Means it is the same like what sun does in the same way, but it's not at all good. So that will also lead skin cancer. Habits: smoking, drinking, gutka, eating, pan masala eating. So all this will lead to cancer. Diet, junk foods. Junk food means what? The roadside, the street foods, whatever, processed food, spicy, very spicy food. Those are so much addicted for the spicy food, street side food and a junk food, and it is very tasty because they will be using tasty powder and various other kind of like powders and a thing. So it is not at all good. And once in a while, if you have, doesn't matter, but don't addict for junk and street food and a spicy food. Lack of intake of fiber, carbohydrate, vitamin and minerals. So you have to take a well balanced diet and which contain more fiber, carbohydrate, vitamin and mineral as well as a protein. High intake of animal fat, especially red meat, beef, as well as other like dairy product, excessive intake of dairy product. So it's not good. There should be a limit for each and everything. Deficiency in iodine, it leads to thyroid cancer. So whenever you buy a salt, you have to see whether it contains iodine. So iodine contains salt, you have to prefer for cooking. Prolonged viral and bacterial infection, one after other, you are going on getting the infection. So when you will get the infection, when your body immunity power goes down. So when you get any client, if you are going on getting the viral or a bacterial infection, you have to advise them to approach the doctor in order to taking their own self medication is not at all good. The next point is an unhealable peptic ulcer. Every time burning sensation, before taking food, getting vomiting, or after taking food, getting vomiting. It means you have an ulcer in a stomach. It's not a healable at all. So when you take the medication for the time being short period, it will heal, then again reoccur. In such condition, the client has to undergo proper medical investigation. That's a gastroscopy or whatever the scope, the instrument the doctor will put inside the mouth, and he will internally he does inspection and he will see whether ulcer size, whether it's a deep or a superficial or it is. So what happened, the ulcer when it is not healing, it will become big as well as a deep, and all the protective layer will destroy and finally it leads to cancer. So tattoo, see, this is a passion for many, even for the girls as well as the boys. So once if you put the tattoo, it is very difficult. I think it may not be possible to remove only. It's not at all good. It penetrates inside your normal skin and it leads to cancer of the skin. So it's not at all good. So you can see in a picture ultraviolet radiation, ultraviolet visible in frame. So thus, so what it does from a sun, if you expose in between, sunburn, skin cancer, eye cataract and various kind of skin skin allergies, as well as your skin look like aging. So what are the 7 warning signs of cancer cell? So what's the meaning of warning signs? It is a type of sign, it indicates needs special attention. So immediately approach the doctor. So it warns the client. So as a nurse, it is your responsibility. You have to educate when you get the opportunity, when you are in a ward, because when you have all this knowledge, you have to educate them the 7 warning sign of cancer cell and when they have to approach the doctor. The first one is a C. C stand for change in bowel and bladder habit. Bowel and bladder habit means, bowel means continuously getting constipation or continuously getting loose stool, or an alternative, sometime constipation, sometime loose stool, or a while passing motion there will be a blood. So in such condition they have to approach the doctor. Bladder habit, like difficult to pass urine, or every often like incomplete emptying the bladder. So after come back from others, again feeling to pass urine, or a dribbling of urine, or a continuous bladder infection. So in such condition the client has to approach the doctor. A. A stand for a sore does not heal. Maybe the sore anywhere, anywhere of the body, might be over the skin or anywhere. So whatever medication if you apply, so only that moment feel like healing, then again it will reoccur. So it will increase in a size. So and it will become a day by day deep. So in such condition, have to approach the doctor. U. Unusual bleeding discharge from orifices. Bleeding from ears, eyes, nose, mouth, anus, vagina or urethra. If any bleeding if you find, If you find or if any bleeding, you have to advise the client to approach. Thickening or a lumps in a breast or elsewhere. See, it is a responsibility of the every client. So self-examination of the breast as well as a self-examination of their own body. If they find any lumps, means like elevation, you can see in a picture elevation or a growth, some kind of a hardness, some discomfort, thickness of the skin, so immediately have to approach the doctor. I, indigestion and difficulty in swallowing. So whatever, every often getting indigestion, not getting digested at all. Either loose stool will be there, vomiting will be there, or difficult to swallow, unable to swallow. So it indicates that there is some problem, there is some growth is there. That's why getting difficult to swallow. So approach the doctor. Obvious changes in the mole. So you know that birth mole, we will say some kind of a dark color will be there, no, over the skin. Some it will come as a by birth, some after the birth it will occur. But mole will not grow, or it will not become a day by day dark and dark. Okay, when when childhood, when you see that mole, so it will remain as in the same size. But if any changes in a mole, it will become very thicken. Like when you touch, no, you could feel like very thick, or it will become day by day, it will, the size will be increasing, or very dark, it appearance will be changing. So in such condition, of course, tell the client to approach the doctor. N stand for nagging cough or a hoarseness of the throat. Continuous cough will be there. Whatever medication you take also, it will not disappear or not stop. And when you're coughing, some kind of a sound, abnormal sound, it will come. So in such condition also, of course, so it indicates some throat cancer or a larynx, pharynx and all this. So these are the 7 warning signs of cancer cell. In a very short way, you can remember by using this caution, CAUTION. Okay, so this is very important. They will ask for 2 marks or a 5 marks. Now next we will move on. 7 safeguards against cancer. So what is the meaning of safeguard? It will protect against possible dangers. So it is a best, means before something, prevention is better than cure, we will tell, no. So this possible danger, through some self-assessing, we are finding and approaching doctor immediately for the faster diagnosis and treatment and a recovery. So what are they? 7 basic complete physical exam for adulthood will safeguard against cancer. Which all that? One is a breast, as I said. Regular breast self-examination for any changes, lump, mass, nipple and discharge. See, the ladies, girls, every day while taking a bath, you can have a, you can observe your body from top to bottom, as well as a you can touch and palpate, you can touch and palpate your breast and see if any pain is there, if from a nipple any abnormal discharge comes out, or any lump, if you feel while touching any lump or a thickened skin, immediately should tell the client to approach the doctor. Colon. Colon means intestine, okay, small and a large intestine. It is a best annually, means at least once in a year. See, this is all must after the age of 30, okay. See, this breast regular self-examination once the girl get a menarche, means menstruation. So it is a best after the age of 15, doing breast self-examination. Colon is a once in a year after the age of 30. Like when you approach the doctor, doctor will put like you can see in a picture, doctor will put 3 fingers and he will palpate and see. Through that only he will, that's a per-rectal examination it's called. Through that only the doctor will come to know. Then proctoscopy, some instrument they will put and they will inspect the small intestine as well as the large intestine. If any growth, any color changes, any abnormality, immediately will come to know. So will get the treatment and client will be saved from the major disorder or a disease. Third one is the lungs. Once in a year, as I said, screening once in a year. Chest x-ray, as a taking chest x-ray and seeing any changes in the chest is important. And if anyone habit of smoking and drinking, it's better to stop. Fourth one is a mouth and a tooth. This is also be one of the best examination of approaching the dentist, and once in a year, mouth and a tooth examination. Any cavities are present, any color changes, or any infection or anything abnormalities, and it is a better to stop eating pan masala, gudka and other things which cause dangerous. to the health of the client. Fifth one is a skin dermatological examination, means once in a approaching the skin doctor for if any skin color changes are found, or any like moles or any hardness, any swelling over the skin, if any kind, if the skin color is become dark and dark, approach the doctor and undergo for the whatever investigation. And as I told, stop exposing to sun rays and radiation for long time, and avoid this. Sixth one is a uterus. Annual pap smear exam for human papilloma virus is the best. This is after the age of 35. If you go that from the vagina, they will take a sample through the cotton, and they will send it for in order to identify human papilloma virus, because this causes cancer of the cervix and cancer of the uterus. Seventh one is a testes, self-testicular examination. This is after the age of 15, while taking bath, the boys can, with their hand, they can touch and feel, they can compress and feel if any pain, any hardness, or any kind of abnormality, whether it is in a normal condition or an abnormal condition. So these are the 7 safeguards against cancer. As a nurse, when you get the opportunity after finishing all the works in the ward, go and educate, teach the patient. Okay, now cancer control and preventive measures. Very important, 5 marks or sometimes 7 or 10 marks asking question. So what are the preventive measures? Primary prevention, secondary prevention, and tertiary prevention. There are 3 levels of prevention is there. So what is the primary prevention? Primary prevention means before the disease occur itself, we are taking care. For example, vaccine. Why we will take a vaccine? In order to prevent occurring of a future occurring of some kind of a disease or a disorder, and having a well balanced diet to prevent a nutritional deficiency or any other kind of a disease or a disorder. So this is a primary prevention, maintaining good personal hygiene, sleep hygiene. So all these before the disease occur itself, we are taking measures, that by lifestyle changes, avoiding smoking, drinking, gudka eating, exposing long time for the sunlight, and a tanning bed, going for the salon and exposing for the tanning bed, to stop all that things, all the lifestyle changes, avoiding sedentary lifestyle, having a daily yoga, meditation, exercise. So all that things. The second one is a screening test and a medical annual checkup. It is the best. If anything is wrong in the body, we will come to know in early stage, and we can find the medication and we can prevent from further major complication. The main approaches, as I said, for this primary prevention, one is the education. Educating everyone through school education, through a street, through the drama, or through enacting, we are educating the lay people. Regulation, our regulation means a law, like a gudka, prohibiting the gudka selling, prohibiting alcohol selling. Through the regulation, we can prevent many cancers. Host modification means same lifestyle changes. Now, secondary prevention. What is secondary prevention? Here, already the diseases occur to the client. So, when disease, some symptoms, some signs and symptoms are started to appear, instead of neglecting or just postponing, or just by self-diagnosing and taking home remedies and waiting, and once if it has become very severe, running to the doctor. So, leaving that, when immediately when you come to know something is wrong, some signs and symptoms are occur, already the disease has occurred and it started to exhibit the signs and symptoms. So immediately approaching the doctor, early diagnosis, detection and treatment. This is the secondary prevention. Here already disease has occurred, so immediately approach the doctor. What doctor will do? He will do the physical examination. So when he come to know something, he will advise for certain investigation. When the investigation is abnormal, he will advise the treatment. So you will be saved from a complication. What is the tertiary prevention? Here the already the disease has occurred, it is completely neglected, it is gone to a stage where it is irreversible. So in such condition, rehabilitation, rehabilitating the cancer patient, means he is already crossed to third or a fourth stage. So here cure is not possible. At least to make his life better or to increase lifespan, rehabilitation of cancer patient. So rehabilitation means it is not easy from a one person. So when a client has diagnosed in a third or a fourth stage of cancer, when through the surgery it is not possible completely to cure, but sometimes they will do the surgery to make the client to feel better or to reduce pain or to increase lifespan. Or so the team is required. The team consists treating doctor, one oncology doctor or a physician, an entire team. Caring nurse, specialized in oncology nursing, one who has done a certificate course in a oncology nursing, so that nurse. Caring nurse, psychologist and a counselor to counsel them and to make them to accept their disease. Audiology, sometimes some of the cancer, the patient or the every vital organs as well as sense organs will damage and come. In such condition, audiologists are required when a ear is damaged and the client is deaf, of course. Occasional counselor or therapist. See, when client is in a third or a fourth stage, he feel I'm a worthless, I'm unable to do anything. It is a better let me die. So in such condition, it is a occasional counselor is needed. Whatever in their condition they could possible to do based on their skill. So they will teach them, and through that they can earn little money, and we can try to bring happiness, smile in their face. Recreational therapist and other healthcare professional. See, when the client is come to know he is a cancer, so immediately the client will undergo psychologically depressed and he will start to isolate from himself because he consider he is a worthless, he is unable to do anything. In such condition, recreation is very important. Make them to mingle with others, and he too is a part of the society in order to make him to understand. What are the areas that required attention in a process of a physical rehabilitation? See, one is the independence. Regarding independence, though he is in the third stage, fourth stage, whatever the part of the cancer it may be, we have to make him complete independence, not to depend on other. How much he could possible, he should be capable to do by himself. That is the independency. Body image. When cancer patient, when they undergo for the various treatment, their hair will start to drop, they will become lean, their beauty will go, so their body image will alter. So psychologically they will upset a lot. In such condition, we have to make them to accept what they are. Speech and confidence means whatever the defect, one by one defect is occurring, so we have to give a confidence. First thing, we have to make them to accept what they are, and we have to boost confidence with them, and we have to encourage to speak out with everyone. See, when if it is a married couple means when they get a cancer, automatically their sexuality will be affected. So they will have that negative thought, I cannot satisfy my partner. So in such condition also, counseling is a very important. Dignity, we have to tell them they too have a dignity in this society, and we have to treat them with a dignity, and we should encourage them, and we should tell them not to feel themselves low anyway, because disease, it may come for anyone, it will not come by saying. So we have to respect them. We have to, with a dignity, we should talk to them. Family, regarding we have to touch the family also, because when they, even the family members, when client come to know suffering with a cancer, if is a head of the family, means head of the family suffering with the cancer, means the family, what they will start to neglect the person, because now he is not earning, he is a helpless. In such condition, we have to counsel every family members. Use of prosthesis, there are for the many cancer, when once the organ is removed, prosthesis is available. Now the cancer of the leg or a hand or a breast, once removed, same like imitating prosthesis is there. So regarding that also we can deliver education to them. Physical appearance, regarding their appearance also we have to counsel, and we have to make them to accept how they are and what they are. And finances, regarding the finances, we have to for the client also, one who is suffering, as well as the family members also, because they will be under financial crisis, how to handle that financial crisis, regarding that. Okay, now Psychological rehabilitation is a must. We have to counsel because emotionally the client as well as the family is depressed. So here we have to touch, we have to consider entire family, not only the patient. Okay, psychological rehabilitation means counseling is very important. Psychosocial rehabilitation, as I said, the client, the patient as well as entire family members start to isolate themselves. They will stop talking with the others because everyone will depress. In such condition, client as well as the family members are socially means social rehabilitation is very important, encouraging them to talk with others and a participation in every activities of the society. Occupational rehabilitation, the client, whatever according to his condition he is capable to do the work, encouraging him to do that particular work and to earn something. Recreational rehabilitation, mingling with others and engaging with some kind of a mind diversional therapy. So responsibility of nurse in rehabilitation. As a nurse, what is our responsibility? First thing, we have to make a client to respect himself and accept as he is or she is. Psychological support, counseling, answering whatever question they are asking in a rational way, not in a irrational way. Okay, you are in a third and a fourth stage. Okay, in a very short span, you will die. No, you're not supposed to answer. And going and standing in front of the patient and expressing "Ayyo Papa." This "Ayyo Papa" will not cure the patient. It will still more make down the patient. So you're not supposed to use such kind of expression, "Ayyo Papa," all that things. Very rational way you have to answer for their question. Conducting recreation, encouraging to do some work, family support, coordinating team activities. So along with the doctor, all the activities has to coordinate and handle the client. This is the major responsibility of the nurse. So I stop this video here, but still the oncology nursing is not complete. Still there is a lot of things are pending. So I'll continue in the next video, part 2, oncology nursing. Very soon I will upload. So to be in constant touch with my nursing educational video, subscribe my channel. If any doubt, if you want to ask any question, you can comment in a comment box. If you like this video is useful, you can press like button. Through that you can encouraging me. So this is a very much useful for you to make a notes, and a very easy way I have made my notes and I'm explaining. Thank you so much, student.